Hi, we're here at Nurse Wellbeing Week. I'm Tara, your host, a registered nurse out of Nashville, Tennessee. And in this session, we'll be discussing changes you can make in your career while facing burnout but still staying in the nursing field. This session will be moderated by Alice Benjamin. She's an on-air health contributor. You may have seen her on The Dr. Oz Show, Fox News, and BBC. She'll be speaking with two nurses about the matter. Let's see what they have to say.
Hello and welcome to the Nurse Wellbeing Week presented by Keener App, NurseGrid, and HealthStream. I'm Nurse Alice, clinical nurse specialist and family nurse practitioner, host of the Ask Nurse Alice podcast, and chief nursing officer and contributor at nurse.org. And I'd first like to kick this off by asking you a question. Do you love nursing but need a change? If so, you're not alone. I've definitely been there and have made several changes over my career. And for the past several months, millions of other nurses have been in the same boat, needing a change, but they love nursing, combating things like burnout, compassion fatigue, and many other stressors from the pandemic. So before you completely burn out and decide to leave the profession, we'd like to help you refresh and reinvent your nursing career. So here to join the conversation are two amazing, wonderful nurse leaders, well known in the nursing community. First, I'd like to introduce Amanda Gornieri. She's an Ivy League educated nurse practitioner and career mentor who helps nursing professionals find, land, and love their dream jobs. She's also the founder of the Resume RX, as well as the NP Society, a professional membership community that focuses on helping NPs thrive in the clinical setting and beyond. Not to mention, she's also the host of the Nurse Becoming podcast. And also joining the conversation is Wally Khan, a Chicago-based trauma ICU nurse. He's also a motivational speaker. He's also a doctoral nurse anesthesia student and young and youth adult mentor. He's also a powerful writer with powerful narratives and perspectives on the balance between faith and medicine. He's passionate about nursing, faith, and community service, and he uses his voice, especially on social media, to highlight the intersection between the three. So let's get to know our panelists. Amanda, can you please tell us a little bit more about yourself and how you became the founder of the Resume RX and NP Society?
Sure. Hi, Alice. First of all, this is so fun to be on with both of you. This is going to be a great discussion. A little bit about my background. Back in 2018, I was working as a nurse practitioner, and I had cut my hours from full to part-time to spend some more time with my newborn twins. And during that time, I was looking for another way to contribute to the profession. And something that I noticed was that nurses and NPs were really struggling to articulate their value in the workplace, whether it was on paper with their resumes or in person in interviews or negotiation discussions. So that was something that had always been a strength of mine. So it inspired me to start the Resume RX business. And so I've been able to contribute in that way, helping other nurses and nurse practitioners with their career satisfaction, their career growth, and success. Because to me, I want nurses to be happy and I want them to be fulfilled, because I really believe that when nurses are happy and fulfilled, that really trickles down into exceptional patient care, which I think is what we all want and hope for. So that's a little bit about my background.
Oh, wonderful. Thank you so much. And resumes definitely are important, especially when you're looking for that job. As we refresh ourselves, we'll have to get more into that. Thanks, Amanda. Now, Wally.
So I was at the bedside for about 5 years. It was my first job right out of nursing school. After many rejections, because, the dilemma that we have is everybody wants experience, but nobody wants to give it to you. And I'm not sure how we're supposed to get experience as new graduates. So I kind of struggled a little bit in the beginning. And I started off in med-surg and did the ultimate bedside nursing. I mean, they call med-surg the backbone of nursing, because you get anything and everything. And you really learn humility and bedside manners in med-surg. And I transitioned to critical care because that's where I always wanted to work and where I saw myself. And I was at Cook County Hospital, which is one of the first trauma centers in the United States. It was founded in 1966. And it was one of the most invigorating and life-changing experiences, just because of the patient population that we had. It is a government safety net hospital. So we saw people from all scopes of background, socioeconomic, health, physical, cultural backgrounds. And so you learned a lot. And after about 5 years, I made the transition to want to go back to school. And due to personal reasons, I wanted to, big thing for me was scope of practice. And as I have two nurse practitioners here, I know that's a very, hot topic right now. But just to really be able to expand myself mentally and academically, intellectually, and push myself and see, okay, what else is out there and what can I accomplish with what I have, with my nursing degree? What else can I do to give back? And so that prompted me to pursue a higher level of education. And here we are, year 2, almost starting residency soon. So
That's one of the beautiful things about nursing. There's so many things that we can do in nursing. And so like myself, I've been a nurse for a very long time. I actually even started my career off as like a nursing assistant, LVN, RN. Then I went back and I became a clinical nurse specialist, worked in that role for a very long time. Got a little frustrated because I didn't have prescriptive authorities and went on to be a nurse practitioner. And I've loved every step of the way. And also I'll be honest, sometimes when you're working in a role for a while, I don't want to say you get bored, but maybe you hit a glass ceiling or you get a little frustrated. You're looking for new opportunities. And so one of the things that I would do is always look for something else that I could do, something different that I enjoyed, because although I really love taking care of patients, I was always looking for how can I make this fun and enjoyable. And one of the things that I started to do was I actually started to do, the very same patient education that we do at the bedside. I actually started doing that on different platforms. So a little bit of radio, a little bit of television, and now that's turned to a lot of television. So, although I'm still very much in the hospital and taking care of patients and those type of things, I've been able to kind of refresh and reinvent myself as a nurse, still doing nursing education, patient education, but using a different platform. So I always attribute that to how I've kind of kept my nursing career fresh and fun. So you guys, Amanda, Wally, there's so many nurses out there, especially during this pandemic, who are a little frustrated, a little tired, burnt out. So, first off, how does a nurse know when they're feeling burnt out? Like, what were you guys feeling when you started to say, hey, it's time to do something different? Amanda, we'll start with you.
Yeah, so before I cut my hours back, I was definitely feeling a bit burnt out. And in hindsight, I didn't know that that's what it was at the time, but I have that perspective now. And I'm an emergency room NP, and the job that I do is, literally saving people's lives, right? Like not everybody, but that was the nature of my job, was recognizing life-threatening emergencies. And at the end of the shift, I would feel like I didn't make any sort of impact. I would go home and I would just feel completely detached to really the great things that I had done for my patients that day. And I was really frustrated with that. It was not how I expected to feel. And on top of that, I was a new mom and I had other caregiver responsibilities outside of work. And kind of towing the line between those roles was really difficult for me. And in hindsight, that was definitely one of the big stressors on me navigating, what, like I said, in hindsight ended up being burnout. And the other thing that I had was, I heard this term recently, I didn't know it until recently, is the Sunday scaries. And granted, I didn't work Monday through Friday, so it didn't happen on Sunday, but whenever it was the 24 hours before I was getting ready to start my shifts, my string of shifts for the week, I was anxious, I was depressed, I cried, I didn't want to go to work. And it wasn't that when I got there, I wasn't fine and able to do my job, but just the anticipation of going to work really had me not in a mentally good space. So I think those are how things manifested for me. And after talking to a lot of other nurses and advanced practice nurses experiencing burnout, those things, detachment from your work, the Sunday scaries, anxiety, and difficulty enjoying your time away from work, I think are some big clues that there may be some underlying burnout.
Oh my gosh. Just real quick, I would pull up, I don't know why, I would just get cranky and irritable, like the day before I'm about to go to work or the morning of, and I was just really a crab. And then my stomach would start to twist and turn, and I felt like I was catching a cold. So it really probably was that anxiety of just not wanting to be at work, because there are some days where you just feel beat down. Now, and there are days, nurses, just so you're listening, there are days where you feel great and you save the day, but it's, especially with this pandemic, we've been seeing a lot of heavier days. So, okay. But thanks for telling me, giving that a name. Now I know what that's called. Wally, what about you? I know the trauma ICU is crazy. So tell us about that.
Amanda, I think what you've said resonates with a lot of people. You were in the ER. I was in the trauma resuscitation unit. We exclusively took trauma, and medicine was the ER portion of it. So MIs and strokes and, oh my God, I'm delivering my baby into your front door. Like, that was ER. For us, it was west side of Chicago, gunshot wounds, stabbings, house fires, rollover car crashes, freak accident, and somebody electrocuted themselves and 50,000 volts just went through their body. And, a charred human being is in front of you. And so one of our surgeons said it the best. He goes, I live people's nightmares for a living. Because, what we see is, if a normal person was to see it, undeniably, they're going to have post-traumatic stress disorder. I mean, they will see it and they will have nightmares about what we do, but we have to do it day in and day out. And for years and years and years, I was working with some nurses that have been working in that unit longer than I've been born. Right? They've been there 35, 40 years at the bedside. And they're remarkable nurses. But something's not right. And you can tell by just observing their personality, they actually have PTSD. And by looking at them, and this may sound bad, they say sometimes by being at the bedside, you learn how not to be a nurse. And sometimes you have the preceptor way, right? And you have my way and the right way. And you watch some preceptors and you watch some nurse and you say, I'm never going to recreate my practice like that. And so for me personally, I didn't experience burnout. And not everybody does. I loved what I did. I absolutely did. And I wish I never had to leave it. But I ran into a combination of what you felt, Alice, and Amanda, what you felt as well. And commenting on what you mentioned first, Alice, was I felt very constricted and confined in my role at the bedside. I mean, I loved what I did and seeing patients, and we were literally saving lives every single shift that I'm there. That's the whole purpose of us existing, right, of a trauma system. But I could only do so much within the glass ceiling that I was confined to. I was a registered nurse. I couldn't prescribe. I couldn't do any surgical procedures. Sure, I helped with chest tubes, and there's a thoracotomy happening, and yeah, I'm putting IVs, and we're running massive transfusion protocols, and all these things are happening. But people still just looked at me as a nurse. And it was true. I had a limited scope of practice. And I got certifications and I got things of that nature, but I personally just felt so restricted with how much I can help people. And then the other thing was, when I first started nursing, when I first entered the trauma ICU, I asked one of my preceptors, I'm like, how do you know that you're burnt out? I asked him that because we were seeing, the first day we were there was like a gunshot to the head. And I'm like, this is me on orientation. And I'm like, what? And he's like, when you come to work and you no longer feel the pain of human suffering and what they're going through, that's when you have to go. He's like, you got to step away. You don't belong here. And this is somebody that was a ex-Marine that had been working as a trauma ICU nurse for 16 years. And this was him telling me that. And this was a man with a lot of empathy. And so I really internalized that, and I said, if I go into work and I no longer see human beings in front of me that are experiencing the worst tragedy of their life, and I see it as, crap, it's 1900, I gotta clock in. I forgot to get coffee. Oh, you know what, I gotta go to Walmart on the way in. And that's all I thought about, and not the reality of what I'm experiencing. Something's missing here. And so I think for a lot of people, when they begin to have physical manifestations of things like Amanda was, where you're literally crying, where you're literally sitting in a car having to contemplate, oh my God, I have to go to work. And you've got the Sunday scaries and, the whatever else you want to call it, the Friday freakies or, the Friday frightenings, whatever. You have to really, take some time to reassess and say, what's happening with me? And what I noticed with this phenomenon right now with COVID, that's traumatic. It's a very different kind of trauma. And the tail end of my career, my bedside career, I worked trauma ICU and I worked as a resource ICU nurse to where we went to any unit that was over flooded to go help out. And when you're really seeing a trauma, a COVID patient that is on full-fledged everything, we're talking ECMO and a fever of a consistent 105 degrees with every drip that you can think of, prone, and you see that every single day, you are so physically, mentally, emotionally, psychologically, and spiritually exhausted. Of course you want to run away and never come back. Except you can't, because you're the person that's responsible for helping them live.
Wow, that's very powerful, and I can just envision that as you were telling that story. And for many nurses, we've been thrusted into this pandemic. So many of us loved what we do. We loved our unit, had besties at work, and it was all good. And then we were thrusted into a world pandemic, something that were never prepared for. And some of us very burnt out, but we love nursing. We know that this pandemic can't last forever. I don't want to leave the profession. What can I do, guys? What can I do to help alleviate some of this burnout that I'm feeling physically, mentally, and kind of refresh or reinvent my career where I'm excited about going to work again? What do you think about that, Amanda?
Yeah, I think it really depends on what anyone can identify as kind of the root cause of why they are feeling how they're feeling. And I think it's important to kind of preface this discussion or kind of give a disclaimer that we're really focusing on what nurses have control over, right? Like there will always be some systemic factors that affect our burnout that we at this point don't have control over. So I don't like to place blame on nurses for their own burnout, right? But I think, if you individually can identify what it is that you're struggling with, is it the acuity of your patients? Is it the volume of the patients that you're seeing? Is it the amount of hours you're working? Is it the hours during the day? I think part of my burnout personally was the fact that I was working straight nights and then going home, sleeping a little bit and turning into mom for, in a very short turnaround. So I think that it's really important for nurses to kind of zoom out and take a bird's eye view of their professional life as well as their personal life about what they need in order to be thriving, in order to kind of plan those next steps. And those next steps sometimes mean changing your hours, like going from full-time to maybe less than full-time, may mean going to a different department or a different unit or a different specialty setting, or maybe it means a different employer. Maybe the employer that you're working for, there's a values mismatch, or there's something that is affecting your overall satisfaction. So it can be hard to really identify what that problem is. And I think sometimes the initial reaction is, oh, I'm done. I'm just going to walk away. But I don't think that we're doing ourselves a service by doing that without examining, okay, where can I make an improvement here and where can I take control of how things are moving forward?
You raised some very good points. And I was just thinking to myself, how many times I probably was burnt out. And not that I can control everything, like you said, but the things I could control. So like yourself, I would work night shift and I had kids. So I'd sleep a little bit and try to be mom during the day. And listen, I needed the rest. And so that contributed to some of my lack of quality in life, I guess, because I was sleepy, I was stretched thin. And I found myself always doing for other people and not taking the time to fill my own cup and refresh and restore myself. So, but you raised some good points there about, switching specialties, shifts, maybe. Wally, what do you think?
I'll piggyback off of Amanda and you guys. You guys, I mean, I'm sitting here with such wonderful, experienced professionals that I feel like you guys are doing, the blunts of the speaking and giving such wonderful advice that I'm learning from myself. One thing that I've always carried with myself, even as a life philosophy, is you can't pour from an empty vessel. And a lot of times when you're young and you're overzealous, you don't really realize that you're running on fumes. And I'm not talking about like financial fumes. I'm talking about like emotional, psychosocial fumes. And just the way that our culture is adapting, as you can say, is we think that we're invincible, and we think that this transient life that we have is going to go on forever. And I say that because we don't think about what back-to-back 7, 12-hour shifts is going to do to us. A lot of young folks think about the money that's bringing in. You know, an easy answer is, hey man, screw it, just do travel nursing. A lot of money, you know, like you'll get to go see Hawaii. Well, that's not feasible when Amanda is pregnant with twins. That's not feasible when Alice has children at home. And I'm pretty sure that a lot of people that are tuned in can't just be like, well, yeah, I'm going to uproot my life, go sign an 8-week contract, make $50,000, and I'll love nursing again. It's not feasible. It's not practical. It's not applicable to every single person. So what then? And I think you really have to reflect on yourself. Is travel nursing a Band-Aid, or is that going to make me somehow have this love curated inside me, you know? And what is really the issue here? Because, I mean, we know this, right? You have a wound and you keep sprinkling some, you know, bacitracin on it, but you're literally infected with MRSA underneath, and it has spread to the rest of your body. And now you need an AKA or a BKA, and for those that may not know, you need an amputation of your knee, above the knee or below the knee. But you're fixated on putting that bacitracin because it'll help, you know, make it look pretty. Or it's like chasing vital signs when your patient's in shock. You're not really doing anything for the system, but it looks great that you're no longer tachycardic, right? Have you really solved the issue? You haven't. You haven't gotten to the nitty-gritty core, dirty, painful stuff and fixed it. And so you really have to do this invasive monitoring of yourself and say, okay, what's going on? Like, why am I truly unhappy? And I think, and I had coworkers that experienced this, and I can speak to their experience. Sometimes night shift is brutal. I only worked night shift my whole experience, but I didn't have kids. So I went the extreme and did 7 12-hour shifts in a row because I could. I didn't have any responsibility. And I think my advice is, if you're working night shift, see if there's a day shift opening. If you're working day shift, maybe try night shift for a little bit. Also, what a lot of people don't think about is you can moonlight. You can do agency. You can do travel nursing, but it can be within your city. It can be within the hospital systems that are around you, and that's considered travel nursing because you can literally be going from, for example, from Chicago, right, to the next city over, and you can still be home for dinner, and you're still working bedside. And so it doesn't mean you have to uproot your life and go to, like, you know, the bufu end of the country to get away and find yourself. PRN shifts, you know, per diem, as they say. You can still work bedside, but if you have a spouse, perhaps they can have a full-time job where your family is getting the health insurance and stuff from there. But for your own mental sake, for your own health and well-being, working a PRN job that, you know, you're working 2-3 shifts a week, enough to have the fruitfulness and happiness that you desire for nursing, but just enough to say, I need some space. You know, we need a little space in between. And a lot of nurses now they want higher education without going back to school. And there's the other side of the coin where they want higher education. They want to leave the bedside, period. You can have the best of both worlds. You really can. There are programs that offer, and I know nurse.org has a plethora of resources because I myself went through and read stuff, is you can do online education while still being at the bedside, while still being a new mom or an existing mom. And you can do that stuff. Find out what works for your life schedule. That's the thing. You have to find out what works for you. Because unfortunately, nursing care and the nursing profession, it's not a cookie cut answer. It's just not. So maybe a CRN is really good for Nurse Alice, which I know you have, but it's not so much for me. I'm not really concerned with acute care. Well, think about the specialty that you're in. What educational platform can you step on? What degree, what certification can you get? What, 2-day workshop, 3-day workshop, weekend seminar can you attend to put you, in that power position where you have knowledge and you feel more compelled to want to remain where you are and give back.
Working the 7 12s in a row, I've, especially during this pandemic, there's been all types of, bonuses and things that are out there. But I'll tell you this, no amount of money can really make you happy. I don't believe so, because there are times where I have said, you know what, I don't care what you're paying tonight. I'm tired. I want to be home with my family. I want to go to Disneyland. I want to just do nothing and watch Netflix all night and drink, wine and have cheese and crackers, whatever. But I think it's real important that we, kind of like Maslow's hierarchy, look at what are some of those foundational things that you need to best take care of yourself. Because if you're not your best self, how can you be the best nurse, the best mom, the best daughter, the best anything for anyone? And I think it really starts with that. And then as you're moving through your career, and like with mine, I worked cardiothoracic, cardiac surgical, ICU as a clinical nurse specialist, did onboarding, training, and education, and kind of in services, worked with residents. I remember I would teach the residents their ACLS classes. It was very high stress. And when I loved what I did, but I began to recognize, became more aware of how many hours am I working? How many times am I saying yes to a project? Because sometimes no is a complete sentence, guys. No is a complete sentence. It's okay. Saying no to certain things so I can protect and block out time for myself and the things that were important to me. Because what I learned is there are things that are important and there are things that are urgent. I might get a request to participate in an activity that someone might feel is urgent, but on my scale of what's important, family is important, self-care is important. So I know nurses, we are heroes. We're superheroes. Sometimes, at least we that's what people say of us, and we appreciate that and we'll take it. But we're really not. We're Clark Kent. We're human. We need to take care of ourselves. So after identifying like how to best take care of self, I like the suggestions you guys gave about, maybe I need to switch a shift, or maybe I can change a specialty, or maybe I take a course that's interesting and fun to me that can help me broaden my horizon. Maybe I can list it on my resume that will actually help me to transition to a different position, still where I'm able to take care of patients and still do my nursing thing. And again, nursing is the beauty of nursing is there's so many different things. In this past year, I mean, having gone from cardiothoracic, I've in my nurse practitioner role have been overseeing federal COVID testing sites. Like, who would have thought it, right? But I'm still taking care of patients just in a different way. And I also think we need to give ourselves permission. And it's okay that not everyone's role is going to look the same. Like, just because you're not directly at the bedside in an acute care setting doesn't mean that you're any less of a nurse. You can work in an outpatient setting. You can work in, ear, nose, and throats clinic. You can work in, I don't know, HIV, STD testing site. You're still taking care of patients. And I think that's something that we as nurses need to forgive ourselves about, because we kind of have this image of what a nurse is and what a nurse does.
And, Alice, I did something very similar to what you're speaking about. I was in this very fast-paced environment every single day. I mean, it's just as fast as it gets. But, some days I'm not looking for that. Like, I don't need that. And I don't want to play superhero. And I just want to be normal, right? I want to just relax and chill. And I want to explore other aspects of nursing, I don't want to say like the glamorous side, but I also want to feel that. Because I'm pretty sure not every surgeon wants to go every single day and crack open chests and do all that, right? So the initiative that I took, and I thought of that as you were mentioning, this wasn't offered. It was completely on my own foot. I reached out to some folks at the hospital that were responsible for education for residents and for nurses. And I took the initiative to become certified in PALS and ACLS instructor courses. And so as a bedside nurse with no additional pay, they didn't pay me extra, they didn't give me any initiative, but I wanted to because I like teaching. But I also knew that if I took this initiative, I would gain expertise and knowledge that's not offered to anyone else. Because there's a caveat, they're not going to pay you more. And sometimes money can't buy you happiness, right? And so I became a PALS instructor and I became an ACLS instructor. And I did exactly that. I was teaching. I'm not saying that I'm superior in intellect to anyone, but I was teaching and helping recertify surgeons and physicians and residents and nurses, and my own colleagues are now sitting in my classes. And it was a change of pace. It was a change of experience. And it was really, really nice. And it was just something that I would do on a Saturday or something I would do, on my day off. And a lot of times we equate success and happiness and fulfillment to a monetary return. When this pandemic has proven that bonuses and add-ons and all this money that you're giving people, it's not helping them be fulfilled. It's not satiating them internally. It's great, you got a $10,000 bonus, but you're so unhappy. The quality of your life internally, of the things that you cannot purchase, you're so unfulfilled. So what good did that really do?
I want to pivot a little bit. Amanda, because you're the founder of NP Society, I think community is so important. So just like we're having this discussion, and so many hundreds and thousands of nurses are going to listen to this conversation and feel a sense of community, like a place and a space where it's safe to talk about these things, ask each other questions. Tell us about NP Society and how important community is when it comes to trying to find work-life harmony. I used to call it work-life balance, but someone told me it's really a harmony, because you never really can balance career and your personal life. You have to somehow harmonize it.
Yes, I totally agree. And, Alice, the community aspect, I think, is huge. It helps with so many things. It helps with burnout. It helps with imposter syndrome, which is another conversation for a different day. It was a few months ago that I was at an alumni event for my NP program. I went to Yale School of Nursing, and they had an alumni event, and it was on Zoom, and it was the first time that everyone or whoever attended from our class, we were together. We had a chance to talk. It was, peak pandemic time, and everyone was just getting frustrations out and talking about their experience and saying things that they felt they couldn't necessarily say to their friends or their family or their partners. And at the end of the conversation, everyone took a deep breath and they were like, oh, I feel so much better. Just by being able to get it out and debrief and process externally with other people who understood what they were going through. So whether that's something you're doing formally in a membership community or informally with a group of friends, I do think it needs to be kind of away from the workplace, not in your workplace setting, but maybe with some peers or some coworkers after work. For me, I created the NP Society as kind of an online community space for that type of debrief and support as we move through these difficult things together. And I've really noticed that when nurses and advanced practice nurses are in community, it really helps move through these difficult milestones, whether they're milestones related to our current situation in the world or milestones on that novice to expert model that we all experience professionally. Having someone there to witness and hold space for what you're going through and also offer support is tremendous. So that's definitely one of my main tips, is to find who your people are, find a community or create one if there's not one available to you, so that you can process through these things, because that's what's going to help us move on from the trauma that we've experienced, the secondary trauma that we've experienced at the bedside during the pandemic. And the other thing I want to say is I really want to normalize mental health services. We've talked about burnout and depression and anxiety really go hand in hand. So if that's the stage that you're at, if you are noticing that you're really not in a good headspace, please, let's normalize reaching out for mental health support, whether it's through your employee assistance program or through another mental health provider, because I do think that mental health services are definitely something that can help when you're experiencing burnout.
Thank you for that. It's also stressful being in school. Any tips for people who may be doing both work and school, or as far as how they can, not give up and still continue this journey as they refresh their career?
Amanda, I'm going to oppose slightly what you've said. Sometimes we want to be with a group of people or in a circle or space that's not discussing our everyday reality. Like, I don't want to talk nursing. I don't want to talk that. Like, I want some sort of normalcy. And so, and this is just not opposing in a sense, like I wanted to give a counter side of the type of environment. So the society, same thing. Yes, the society. However, I want a society or a space where I can actually feel normalized. And I use that word normal with with an attachment because for us, many times, and I found this happening to me until my wife pointed out, nursing becomes our existence and identity. When it's not. It's not. I'm sorry. If anyone ever thinks like nursing is my life, it is not. Right? Alice, you are a mother. You are a wife. You are a daughter, right? You are an auntie. You are X, Y, and Z. Amanda, you are phenomenal with what you do. You are an entrepreneur. You are an NP. You are a mom. You are a wife. All these roles that you fulfill. Oh, and you're also a nurse. But when you're a nurse, you are a whole dang nurse, right? And you are doing it to the best of your capacity. But let's leave it at that for a moment. I mean, the empathy that you learn at the bedside, it carries over in other things that you do. When you see somebody struggling in the street, at a grocery store, at a stoplight, on an airplane, whatever, that carries over, right? But it does not have to hijack every conversation in every aspect of your life. And so if you're feeling that, perhaps joining a community where you get to really explore other aspects of your identity and personality and what makes life fun and enjoyable and gives you purpose and meaning and fulfillment. Because it's very clear that nursing is not, like 24/7 nursing is not. So there's other aspects of your life that need exploring and fulfilling. So perhaps exploring that and joining a group. And one thing that's so undervalued, but so important, is community service. Not just belonging to a community, but what can I give to others without any expectation in return? Can I do something for someone that can never repay me back? Simply because I'm blessed with X, Y, and Z, with intellect. I can educate, I can tutor, I can give my time, I can give my health. You know what? I accumulated some extra cash. Maybe I can donate some money too while I'm at it. There are so many disasters happening in the world. Not everybody can be a financial humanitarian, but we can be philanthropist with our time, with our emotions, with our speech and kind words that we have. And so how can I be of service in a community while being part of a community? And that has nothing to do with nursing, right? Like, it doesn't have to be nursing related. It can be anything.
Both of you actually raised some good points. I was like, oh, yeah, that's right, Amanda. Oh, Wally, yeah, I mean, you guys, we know many of you are burnt out. You're feeling like you're on your last leg. You want to leave the profession, but we want to say that we really need you. You're doing a great job, and to continue what we're doing, and that, you've listened to so many tips that we've shared today. And this is just the tip of the iceberg. There's so much more, and this conversation needs to continue. But we'll have to do that outside of this forum. But I'm so thankful for Amanda and Wally, who's been able to join us and share their expertise. It's been amazing. And also, thank you to KeenerApp, NurseGrid, and HealthStream for putting on Nurse Wellbeing Week. Truly, truly valuable information. But before we go, I want to make sure that we can continue conversations like this, and you can follow up with our panelists. So Amanda and Wally, if you guys can tell the viewers, where can they follow up with you and learn more about you?
Sure. So the best place to follow me would be on social media. On Instagram, I'm at the Resume RX. You can follow me there for career tips, resume advice, and then I share links to other places that you can learn from me there on Instagram.
Wonderful. Thanks. Wally, where can we find you?
Right now, you can find me hidden in the cave studying textbooks. That's all I do now. So this was like the most refreshing thing that I've done in a very long time. I don't get very much social interaction nowadays, but if you are looking for me, you can find me on Instagram as well, Wally_Khan. And I really do try to keep active with much of my life right now is school. But I'm not oblivious to the realities of the world and what nurses are going through and what we as a human family are going through. So I think we have some very interesting, emotional, heartfelt, real dialogues. So if you are on social media, I'd be happy to, exchange some words and just sharing this life experience with you. So
wonderful. Thank you so much. And guys, I'm Nurse Alice. You guys can follow me on social media. I'm on all social platforms at Ask Nurse Alice. And just that, you have a question, want to chit chat, just ask me. We can start a dialogue. And then also you can catch me on the Ask Nurse Alice podcast brought to you by nurse.org. You can visit their website and get a link to all of the different shows and topics that we've done. But that's one of the ways that I kind of keep my nursing fresh too, talking about important topics in nursing, healthcare, while still at the bedside. So that's how I do kind of some of my work-life harmony as well. So guys, on behalf of KeenerApp, NurseGrid, and HealthStream, I want to thank you so much for joining us on Nurse Wellbeing Week. And again, thank you to Amanda and Wally for joining. And you guys, until next time, make good choices, be kind to one another, and live well, my friends.